Although the first anti-tuberculosis drugs were discovered more than 60 years ago, the disease still kills an estimated 1.7 million annually. Progress in attempts to improve the diagnosis, treatment, and control effects worldwide over the past 10 years have yielded good results, but have been largely hindered by the undermined HIV-1 epidemic, the increase in dramatic drug resistance, and various other factors. On March 24, 1882, Dr. Robert Koch announced the discovery of Mycobacterium tuberculosis, the type of bacteria that is known to cause TB. At this time, it was said that TB killed at least 1 out of every 7 people living in both Europe and the United States. Tuberculosis can form at any time during a person's life. It can also attack almost every organ in the body. However, it is most commonly found in the lungs, mesenteric glands, small intestines, and pleura. The disease itself can develop via 3 forms, including miliary, aggregated, and infiltrated. Symptoms of active tuberculosis include evidence of a fever, night sweats, chills, loss of appetite, fatigue, unintentional weight loss, chest pain, coughing up blood, and/or coughing that lasts for 3 or more weeks. It's believed that those most susceptible to tuberculosis were those in poverty, and especially those who performed work in large, overpopulated cities. The tenant houses of New York were unlike those of any other area in the country. It was argued that the occupants had, quote, less personal interest in and control over the character, cleanliness, and surroundings of their domiciles than is usual in other cities. According to an article published in 1865 by the New York Times, the public dispensaries of New York provided annual medical care for around 150,000 people, almost all, about 90%, of whom were residents of tenement housing. Tenement housing offered very little ventilation. It was reported that the, quote, want of proper ventilation is an especial cause of insalubrity in domiciles occupied by many families. Apartments were often so overcrowded that individuals were given only from 400 to 600 cubic feet of air, and by night, the number of cubic feet for each occupant was reduced to 200 feet. In addition, it becomes very clear that hygiene was not largely focused on, making it very easy for different types of bacteria and literal waste to accumulate. Adelaide Dutcher, one of the lead medical students involved in the study, said that, quote, nevertheless, I am happy to say that in the few cases in which subsequent visits were made, I found visible signs of an effort to follow my directions, end quote. In addition, she recalled saying that, quote, at a second visit 1 week later, I found that the floor had been scrubbed with lye, and the patient was carefully collecting his spit in a vessel containing antiseptic fluid. The mother showed herself to be especially grateful for my few words of advice and warning. It's said that sanatoriums were first established in Germany during the mid-19th century and were designed to cure TB through applications of fresh air and exercise, diet, and graduated labor. In 1875, in Asheville, North Carolina, Joseph Gleitzman opened the first sanatorium that had ever existed in the United States. 9 years later, in 1884, Edward Livingston Trudeau opened the second, called the Adirondack Cottage Sanatorium, located in Saranac, New York. Many sanatoriums fell short in their promise to seclude and isolate the infected. For example, institutions under financial pressure discharged or released patients who appeared as if they had improved. During a large portion of the sanatorium era, a variety of therapeutic interventions were introduced and often used in the treatment of pulmonary tuberculosis. These included artificial uniformax, thoracoplasty, phrenic nerve crushing, plombage, and lung resection. One of the simplest procedures consisted of bed rest in a particular position. Patients were placed in an upright position, allowing or giving way to the gravity-dependent distribution of pulmonary blood flow, creating high oxygen tensions in the apices of the lungs. Although patients appeared to have recovered notably well during sanatorium treatments, the long-term results were quite depressing. American statistics show that more than 60% of patients discharged from sanatoria died of their disease within the span of 6 years. This included 17% of those deemed cured, 51% of those considered stabilized, and 72% of those who were said to have improved. In 1943, Selman Volksman discovered streptomycin. In 1951, isoniazid was developed. In 1952, parazinamide was discovered. In 1961, eptiambutol was developed. And then in 1966, rifampin was discovered. Tuberculosis was a disease born of poverty and poor living conditions. By studying the tenement housing that existed in New York, one can clearly see that drastic poverty ultimately contributed to an increase in the spread and number of cases of TB. It's possible, therefore, that if the government had taken a closer look at the root of the problem, the number of those left dead from TB at the time might have been lessened.